లేదు సార్.
ఇప్పుడు దాకా నొప్పి ఏం లేదు కదా?
లేదు సార్.
Sorry, okay, fine. So these are the, usually I make external osteotomy and I make at the junction of the, or just slightly above the junction of the nasal bone and the facial bones. So this is how I made it, a small cut, 2 to 3 millimeters, and another one symmetrically on the other side. So I will separate the periosteum a little. So one should be careful so that we don't avulse the middle canthal ligament. Instead of going so close to the bone, just slightly above, I'll go superficially a little. So the low to low or low to high osteotomy is depending on that we do some amount of elevation. If it is very low to low, I go very low here. If it is low to high, a little slightly anterior, I'll go, or else I'll go slightly posterior like this. Sometimes if the bones are not straight and a little convex on one side, probably I needed a double osteotomy. And usually with the double osteotomy is one cut on this side and then one is somewhere in the middle, so that the convexity becomes straight line. So this is a 2 millimeters osteotomy. కొంచెం నీకు కొట్టినట్టు ఉంటుందమ్మా. Close your eyes, అమ్మా. So instead of going at one go all the times, I go a little superficial. That is, I don't cut the entire bone in one sitting. So one should make sure that it is at the junction of the facial bones and the nasal. Otherwise, what happens is a remnant of the nasal bone remains, and then the width of the nose doesn't seem to be corrected. So I doubly make sure, so that I don't leave a piece of nasal bone on the facial bones. Yeah. Slow. So this is one area where there is a amount of buttress. We can feel you can hear the sound also. Yeah. So here it is delicate bone. Gets fractured easily. Yeah. Yes. So I can feel that the bone is fractured here, but not here in this area. Yeah. Yes. Yes. Now I will fracture on the right side, and I didn't make any cuts on the left side. So just to make sure that it is there, just fracture it. I can feel it, but you may not. Sometimes we hear the sound, and mostly we do hear the sounds. But here they're so soft, and I hardly could hear the sound. But it is fractured, you can see it. And this side also. This side has gone inside a little, but not on the left side. Yeah. Do it on the other side. We'll repeat the same step on the other side. Now we'll see whether we can hear the sound on the opposite side, that is on the left side or not. So it's not yet fractured, I can see. Yeah, this side also is fractured. Yeah, you can hear the sound, I think. You can see on the side also there is narrowing. And now we'll try to shift the bones with the manipulator. These are the nasal bones manipulators. Now we have to shift the bones slightly to the adolescence, so that to make it straight. So now we'll see whether it is near straight or not. Yeah, pass please.
Pass.
I have done close. I have done some scoring on the other side, scoring on this side and then scoring on this side, so that the concave or convex part gets straightened up. And I will place a drill hole and then suture this part of the caudal septum here down to the bone.